cards.
Okay, everybody, wait. Wait. Why have healthcare costs risen so dramatically within the past decade? If you ask some of my colleagues, they will tell you healthcare costs have risen because people who do not have insurance are actually overusing and, in fact, abusing emergency departments all across this nation. But is that actually the case? Not according to the Robert Wood Johnson Foundation study conducted in 2009. This study, entitled Emergency Department Utilization and Capacity, actually found that the volume of emergency department visitors was made by people with insurance, 40% of which was private. And so people with insurance are the ones who are actually misusing emergency departments. But there's more to the problem than that. Because what we also know is that people have a responsibility to make choices that promote health, and unfortunately, poor choices is yet another reason why people are flocking to the emergency room. These choices are related to habits such as smoking, dietary concerns, as well as substance abuse. And so, what we find if we consult, for example, Matthew Waimea of the Hastings Center, he will tell you that Americans spend $100 billion on obesity and smoking-related illness alone. And that's a sizable amount. And as a matter of fact, they'll tell you as well that if you can use that money, if we could recapture that $100 billion, you could actually provide insurance for all Americans. So what we have here then is a situation where the healthcare crisis can be attributable to two important facts. Number one, people who are overusing the emergency departments who are insured, and why are they doing this? My perception, based on my studies, is that they are doing this because the resources within their communities are either scarce or inadequate. Either the community health centers are open at hours that are inconvenient, or the service they provide is just not adequate enough to meet the needs of people. The other reason then is poor choice, personal choice, and it needs to be amended. There are two important steps that you and I can take to change what's going on with America today in the area of healthcare. The first step is we should urge our lawmakers to increase the number of healthcare centers within all of our communities. The second step is we need to promote and model behavior in which people are shown the importance of prioritizing choices that promote health. The National Association for Community Health Centers is at the forefront when it comes to promoting adequate healthcare facilities within the community. And as a matter of fact, they refer to these health centers as the medical doctor who's out there serving the underserved, the medically mismanaged, as well as those in rural and urban areas who don't have access to care. You and I can support the NACHC by championing their cause when we go to the ballot and voting for initiatives that improve universal access to health care. We can also speak to our state and local lawmakers and urge them to support any kind of initiative that increases funding to put more community health centers within our different environments. And the third thing that we can do, because you're all in the healthcare field, is you can advocate by explaining and helping others to understand the importance of these healthcare centers in reducing the strain on emergency departments. Something you do want to know is that the Robert Wood Johnson Foundation also found that even though people with low income, people with measurable physical and mental illness were frequent visitors to the emergency room, that only accounted for a small volume. Would you believe the rest of that volume actually came from people who are simply misusing the emergency department? And so the change that you can make as it relates to that part of our population is in how you approach your patients, how you approach your colleagues, your friends, and your neighbors, and promotion of healthcare behavior. One type of promotion that you can make is in support of what's referred to as the syntax. Catherine Reynolds of the New York Times actually tells us that a syntax goes a long way in helping people understand and rethink what behaviors are bad enough to be taxable. Leslie Geberts of the Reuters actually reports that in fiscal year 2009, $6 billion alone was collected from tobacco use. That $6 billion could be funding community health care centers all across our nation. And so if that initiative arises on the ballot, please support that initiative with your vote. Other things that you can do as you speak to people over whom you have influence is talk to them about the importance of exercise and about the importance of making good food choices. Allison Aubrey of National Public Radio reported on the University of Buffalo study this year in which people were monitored in their shopping, specifically mothers, and what they found was that when healthful foods were priced low, those mothers actually purchased them. So then they took the money they saved and they purchased junk food with that money. That was not the intent. And so the next thing they did was they levied a heavy tax on junk food, and they found that was what it took to get the mothers to stop buying them. You see the importance then of the syntax. You see the importance of telling your patients, telling your friends and your family about the important food choices that promote health. And if I could push for syntax, what I would push for is syntax to be applied to tobacco, to alcohol, and to foods and products that actually are not healthful but have been shown to detract from health. And that's something you want to consider. It's not a perfect world, it's not a perfect idea, but any steps that you take to modeling the appropriate behavior and any steps that you take in educating others will go a long way to reducing the strain on emergency rooms because people won't need them for preventable illnesses. And so what we have then is a healthcare crisis attributable to two problems. The first one then is simply misuse, and it's by people with insurance. But if we increase the number of community centers within each community, those people can start going to those communities and use the emergency departments alone. And the second problem is related to personal choice and behavior, which can be changed by your advocacy and by your education and by your modeling. Any step that you take, even one of these steps that I previously discussed, will go a long way into reducing the strain on the emergency rooms, reducing the contributing factors to the healthcare crisis, and it will also go a long way to preserving our precious resources.
I think I did it that time. Oh, y'all will laugh at me.